So I'm sure a majority of you, just like any people around, you realize that the trends of patients being managed from home are growing each and every day. Because indeed, if you have your patient admitted in a hospital, probably they have a chronic illness, it's quite a draining journey for any person, both financially and even psychologically. You having to make those trips each and every day to go to look at their progress in hospital, it's quite draining. But thanks to God that we are able now to transition the care and follow-up of such patients to the home setting. So the best we can do is to avail the most important kind of support to them the best way possible. And there are two forms of support that we can offer to these patients. Either the general support from the relatives, or it can also be the professional clinical support based on the underlying condition of your patient. So there are few things that we will be looking at when you are offering this kind of support, either by a relative or also by the recommended health professionals from the hospital. So number one, if you have been okayed or you've been allowed to take care of your loved one as a relative, let's say they don't necessarily require the professional kind of support, there are few things we need to remember when you're caring for your loved one. We definitely know you are biologically related to this person. It could be your child, it could be your spouse, and so you really want to give the best possible to this person. And along the way, we may somehow tend to overdo some of the things, in the process of giving the love. You support based on the love you have towards that person. But that's not enough, because we may unfortunately end up with a second patient along the way when caring for this person if we don't have a structured mechanism on making sure that the person supporting the patient is also looked after. So what are we supposed to remember when we are caring for a loved one as a relative, for example?